We will start with this day with a keynote by Dr. Claudia Abreu Lopes. And it is an honor and a pleasure to introduce Dr. Claudia Abreu Lopes. She's a social psychologist whose career exemplifies a deep commitment to the intersection of social psychology, public health, and gender equity. Over the past 2 decades, she has excelled in academic roles at institutions such as the University of Cambridge, London School of Economics, and the University of Coimbra. And currently, she's a research lead at the United Nations University International Institute for Global Health, where she spearheads projects on the structural determinants of health inequities, leveraging big data in social sciences and integrating digital approaches into health interventions, particularly in mental health and sexual and reproductive health. Her career also includes consultancy roles with UN Women and work on the charity sector with organizations like Girl Effect and Africa's Voices Foundation. So Dr. Lopes' interdisciplinary expertise and global impact perfectly positions her to address today's most pressing digital health challenges. So it is my pleasure to give her the floor now and enjoy the lecture.
Hello, first of all, good morning. I would like to thank the invitation to be here today. And it's also an honor to be here at ISCTE and to have this talk as part of the Social Digital Lab. So I would like to ask Sonia and the organizers of this conference and also all my colleagues who are here who also contribute for my this journey in the social psychology. So even that I don't work directly on social psychology now, I always try to apply the principles that I've learned in Portugal but mainly in Portugal at the University of Coimbra with collaborations with ISCTE, with the University of Porto, to the work of the United Nations. So I changed slightly my title. I'm still going to talk about equity in digital health programs from design to impact, but I thought that it would be important to bring some conceptual frameworks to discuss them with you, and not to present as the final framework, but to think that we are in a period of transition where our lives are becoming digital lives. There's no difference between digital and non-digital anymore. And we are at this crossroads that we need to make decisions in terms of politics, in terms of security, what are the lives that you want to have in the future. And so I thought that could maybe bring, sorry, I think I need to, I can help if you use this one, right? Yeah. Okay, yes. So I'm going to bring a new concept.
View. Okay. Just to put a menu. Okay. View. Here. Okay. And then full screen mode. Okay. Perfect.
Okay, thank you. So I'm going to talk about equity as part of a framework of digital security and governance. My slides are in Portuguese, but I'm going to speak in English, so I hope that it will work for everyone. So I'm going to talk about this framework for the human security and then give some the main ideas of what are the objectives of the human security framework, the types of human security and the central ideas, and introduce a new concept for the digital security as part of this human security framework. I'm going to talk about also another framework that is the digital determinants of health that I believe you touched upon yesterday briefly. I'm going to talk about the equity in digital health and how it relates to the digital security and governance, and some principles for implementation of digital health interventions that will respect these ideas of equity and security. And I'm going just to give a flavor of what UN is doing at the moment in this regard. So the objectives of human security is to protect the vital core of the human experience. So it means that by by having a framework for human security, this framework was put forward in 1994 for the first time at the UN as part of a report that is published regularly, that is the Human Development Report. And in 94, the world was going to a direction where we didn't need to talk about security as much as militarization and the protection of the nations, because it was coming from the Second World War, the Cold War, and then we could focus on the human development. So this concept of human development was linked to the human security that encompasses, for the first time, the security of individuals, people-centered, as opposition of the security of nations and member states. So it's still the concept of human security as a protection of threats that can be critical and generalized, but we can think that these threats are not military, can be threats related to health, can be threats related to economy or work, and can be threats related to the environment. So the objective is to, by fulfilling the human security, individuals were able to fulfill their human realization. So these ideas of vital core, human realization, and freedoms are coming from a theory from Amartya Sen that published a book in 99, I think it's 99, on the development as freedom, that considered that objective of development should be to expand the freedoms of individuals and their capabilities so they could live the lives that they would like to live. And it's not a coincidence that Amartya Sen was one of the authors that, after this Human Development Report, was incumbent to write this framework of the human security as part of the human development. So there's three fears, three freedoms, and that this human security framework considers. That is a freedom from want, freedom from fear, and a freedom to live lives with dignity. So these freedoms are central on the human rights framework. So thinking about human security is just a framework that allows us to advance the human rights. So far, and when this concept was advanced in 94, there were listed these types of security. There was the economic security, food security, health security, environmental security. There was the personal security that is related with the security from violence, including crime, intimate partner violence, and so on. The community security, and the political security. But the world has evolved. Sorry? Oh, sorry. The political securities. But the world has evolved, and there are other securities that we can consider. And that's why that is the objective of my talk today, is just to, is a reflection why these securities are outdated, and we need to think of a digital security. And maybe we need to think of digital rights as part of the human rights framework, because digital security nowadays interacts with all these securities. So if we undermine digital rights, it means that people may not have access to basic healthcare. Or if you think that there will be inequities related to access of technologies, we may think that people will have inequities in their opportunities to access work. So the digital security is not also a security like all the others. It's a security that is intertwined. All of them are intertwined, are interlinked. But digital security, it's important to think how it's going to challenge the way that we think about human security so far. And therefore, we are at this crossroads in history that, as the same time as 94, the world was evolving into one direction that was less militarized. Now we need to think we are evolving in a direction that is a digital future. So we need to think of what we want in terms of human rights and human security. So there's these main ideas that, so when you think about protecting human lives, is not only the responsibility is not only from the institutions that promote only now is English and Portuguese, yeah. Only the institutions that promote the human security, but we need to think about other institutions that include big corporations, big tech, and others that can intentionally or not undermine this human security. And also in the first framework, the human security was centered on people, but the world has changed, and now we are faced with a big environmental climate crisis. So we need to think of human security as part of a planetary security. It doesn't also involve humans, but all the environment, all the context. So we can think of this new security that is the digital security. So we need to change this paradigm that of securities that are centered on the state to think about all the different actors that will be responsible for protecting the security of individuals in a digital era. And that involves all the civil society and, of course, the member states and corporations and even non-governmental organizations. So the digital security should be seen as a part of this human security, and so far the way digital security is not a new concept, is because it's a concept that has been used widely to refer to protection for cybercrime and cyber attacks and protecting data. So what I'm proposing here is like, let's take this digital security concept to a more human planetary centric approach, in the same way that in the past security was about protecting from attacks. Nowadays is not only protecting from digital attacks, is ensuring that everyone will participate in a digital world where all their freedoms and all their capabilities will be expanded. Okay, so this idea of the digital security was, the idea of it was advanced but not yet articulated in a Lancet Commission in 2011 that was the Governing Health Futures of Growing a Digital World. That was a collection of reflections, of articles. There were webinars, podcasts that involve mainly young people to discuss what is the future that they want for themselves. And there was this idea of thinking about the digital rights and digital security. And in the way that it relates to the equity is still under discussion, but there was this diagram that was advanced that considers that digital technologies is not, if you think about of an ecologic framework, is not one of the layers of the framework. It implies a transformation from all the layers, from the socio-economic, political, and environmental context, to the social and community networks, to the living and working conditions, and the lifestyles and behaviors. We can loosely think of this as the different levels of analysis that we use in social psychology. So we can look at digital transformation, of impacts on the individual, on relations, on groups, on society, and on societal context as a whole. So we move from digital security to think about now digital security for health. So what are implications of thinking of digital security in the health context? So digital security should allow us to advance health equity. So by having digital transformations in the health systems, the objective will be always to advance the health equity. And in the same way that there's the social determinants of health that I believe also that you talked yesterday, we can think of a new framework of the digital determinants of health and think how they relate to one another. So this is taken from an article that was published recently this year, 2024, that is an attempt to see how they relate to each other. Is still a bit underdeveloped because, for example, digital health adoption is not the only condition for the health equity. So all these social determinants of health, they will impact digital health adoption, but adoption per se doesn't ensure the equity, because it depends on how these tools are designed, are implemented, and the way that the impact is, the impact of these tools is equitable or not. Right? So when we think about health equity, normally is the equity in terms of access and in terms of population health outcomes. So you need to think of all the different aspects where equity can be threatened in terms of the digital health pathway. But this framework is very interesting because it breaks down the different components of the digital health determinants. So I'm going to read, they are there. So for example, the ease of use of these technologies, or the usefulness, and usefulness, the interactivity, the digital literacy, the digital accessibility, the digital affordability, algorithmic bias, the technology personalization, data poverty, and information asymmetry. And this framework is very comprehensive because it considers different aspects, contextual aspects in terms of access to data and the infrastructure, the technology infrastructure, to the literacy of individuals relate to the digital, but also the biases that exist in the systems related to algorithmic bias or the user experience of these tools. So I think this, I haven't seen it, I haven't seen this framework in official documents, from WHO or the UN, but I believe that it captures all these different aspects of the determinants, the digital determinants of health. What is missing here is the mechanisms. So we know that they will impact health, but we don't know how. And we don't have enough evidence to understand how, for example, algorithm bias, how it will impact health equity. We know some evidence that there are, for example, some digital tools and some, for example, for mammography, automatic scans and AI algorithms that discriminate against women of color or women of Hispanic heritage in the US. We have some anecdotal evidence that is scientific, but is just showing off cases. In this case, there's discrimination. But we don't have enough research studies understanding the mechanisms whereby the way that these digital tools, digital health tools are designed are going to impact in a different way people from different groups, not only in terms of gender, in terms of race, but people from high-income countries related to low-income countries. So some of the concepts that we use nowadays has to do with, for example, gender inequities in health, that it relates to digital gender gaps, that is not only that women have less access to digital tools, but is like women in with low education, who live in more rural contexts, who are from low and middle income countries, they will have a gap in terms of access and use of these technologies that is higher than other type of women. So I think for people who work on gender, this is clear that, is the intersectional perspective to gender. Is not just to say man compared to woman, is to say there are certain type of women, because of structural inequalities, they will have a differential access to the technologies and different digital literacy levels that will make them use technologies in a different way, and therefore they will have different health outcomes. So we know that these digital gender gaps exist, but we don't have the enough evaluation and impact studies to understand the influence of these gaps in terms of health inequity. other idea here has to do with the north-south comparisons. And at UN, we hear this very often. I don't know if that is also very familiar for you, but has to do with the decolonization of global health. So if you apply a decolonizing lens to the digital health, is when we realize that there's, for example, data extraction from people who use digital tools in the global south, in the countries in the global south, and these digital tools, and we can talk about digital platforms, even social media platforms now with generative AI. So people in the global south who use these tools are mainly created by big techs that are in the global north. So this is a form of colonization of data, because there's extraction, and these people are not the ones who are going to benefit from the outputs of, or even the income of these big techs. So, and if you think this is all corporate sector, is even more extractive. So there's a very serious conversation about the colonizing global health, particularly for the private sector who is based in the global north. So what are the risks when we think about digital health and the lack of governance? So I just lay out here 4 of these risks. One is the lack of lack of awareness and informed consent relative to where this data is accessed and stored and how it's going to be used. And this non-authorized access, we know that will have consequences for the life of individuals, when they are applying for jobs or insurance. If this data is not adequately secure, the health characteristics of individuals will have an impact on, the rights in other spheres of their lives. The second risk of the lack of digital health governance has to do with the algorithmic and data bias. And this will result in inadequate diagnostics that, since these algorithmic and these machine learning models are trained for individuals who are most represented in the data, that tend to be white men with middle age, mainly living in countries in the global north. And then we have the other risk that has to do with disinformation and misinformation, particularly for health, during health crises. And we saw that during COVID, disinformation related to vaccines, that will undermine the effectiveness of public health responses. And finally, we have the fact that there's technologies that are not regulated. Anyone can create an app and put on Google Play, and people can use that and say that is an app for mental health, for mental well-being. But what happens when there are adverse effects of these technologies? So who is accountable for them? And how can we? What are the mechanisms that allow the creators of these technologies to be sued or to be responsible for these adverse effects? In most of the times, there's the terms and conditions that people sign up. When they sign up and they accept, that considers that the creators are not responsible for any misuse or any other negative impact of uses of that technology. So this is one area that lacks regulation. So these 4 areas are related with health information, with the regulation of the technologies, the regulation of the data, and that implies also, informed consent. That I know that in Europe with GDPR, it's not an issue as much. But you probably saw this new line that Elon Musk. It was like, I think 2 days ago, that. There's this new chatbot that Elon Musk has, that this Grok, and they on Twitter he asked people to submit their X-rays, their scans on this platform, so he could train the platform to analyze health information and give diagnostic for people. of course that the objective is not to help people. The objective is to train the models. The more people submit, the better the models will be, and more competitive and more profitable these AI, generative AI tools will be compared to the competitors. But if you read the news, there are many people who work on health and medical doctors who wrote commentaries, articles to discuss the accuracy of these tools, and without any concern about the privacy. And this is just encouraging other people to do the same, right? So we are thinking, where are we going to? And I know this is against GDPR rules, so I believe that, in Europe there will be a backlash about that. But it doesn't, I think it doesn't prevent one of the most, the richer man in the world to go on his own platform and say, please send me the data to this new tool that I'm doing in a way that is not seen as a crime, that I think it is, right? So this is why we need the digital security in health. So what we need in terms of the governance of the digital health. So the governance will allow us to mitigate and to prevent some of these risks in direction to a world where we have digital security. So governance, digital health governance, is a multidimensional approach to regulate, to coordinate, and to ensure the responsible use of digital technologies for health. And it includes laws, politics, and guidelines to collect data ethically and with informed consent, meaningful informed consent, so people know what they are consent to, and considers the rights, the norms, and responsibilities and risks of these technologies, with objective to promote equity and to ensure the ethical use of these technologies for health. So what are examples of how can this governance can be implemented in terms of systems that are interoperable, in terms of human resources that will be trained of how to use these technologies, their risks, and how to mitigate them, in terms of developing global digital goods, and these global digital goods are goods that are accessible to the public. They can be governed by governments or not, can be governed by a coalition of governments with NGOs, even with the private sector, if they have ethical aims. And we also need to think of a cooperation. So we need multilateral international cooperation to develop these guidelines and laws, because one of the challenges at the moment, and I'm not a law person, and probably some of you are, but I believe that one of the problems is that these laws are national, but the digital world it doesn't have borders, physical borders. So how can we have laws that apply to certain tools and certain platforms that can be universal, right? So there's, of course, we need to have an effort from the private sector to develop these tools and platforms in an ethical way, but we need to involve civil society and governments in the development of these platforms. And, civil society, they have a lot of power. We can see that people now are moving from Twitter, they are going to Blue Sky because it's a bit more ethical. So we can do that as consumers, right? But we need concerted efforts also to do that. And these concerted efforts involve the international community. And finally, we need policies. We need policies that are strong and robust. And for example, we ensure that data can be transported, can travel across borders. This is important, especially for health data. We saw that during COVID vaccines. So we need to share the knowledge that we have with other countries. If you need to join effort, for example, during a pandemic, or if you want to look at the innovations in terms of health, it cannot be only in the hands of some countries. We need to make this data, the algorithms, available, but I know that there are some legal implications of data going cross border, especially for health data. But I believe that the European Union is already leading the way in relation to to that, about data, health data that can be sent to other countries. So what are the different initiatives that, or different organizations that are also leading the way at the moment? So there's a digital health strategy for the World Health Organization that is, I think, from 2020 to 2025, and talks about these ethical principles of implementation of digital health technologies, and it considers questions related to the design of the technologies, for the gender intentional design of technologies, or the digital gender gaps, consider algorithmic bias, all these risks that we have discussed here. Finally, I think I should finish soon. When we talk about the governance, going back to the first part of this talk, we need to think about what the governments, in collaboration with civil society, with the private sector, can do to contain these digital risks in a way that will respect human security and will ensure that the digital policies they are not going to harm inadvertently the individuals, and they will contribute, that can contribute to aggravate the existing inequalities. So there's also this positive technology approach that considers, oh, but if you invest enough in technology and if people are digital literate, we can always find solutions for the problems that we are facing at the moment, including climate justice. But we always need to think what are the unintended consequences of these technologies. They are never a solution. Technology cannot be a solution for something. It's always a means to achieve something. The solution needs always to be a human or planetary-centric solution. So we need to think about these unintended consequences. So one of the initiatives that is in motion at the moment is a multilateral initiative that is the Digital Global Compact. You may have heard that recently there was this document that was signed. It was in September during a meeting in New York. There was the Summit of the Future. There was the future that you want post 2030. So 2030 is when the Sustainable Development Goal framework will finish, was from 2015 to 2030. So what's next? So we know that there are two very important pillars, that three, that is the planet, the digital, and the youth. So we are talking now about the engagement of youth, but the intergenerational engagement, that goes a little bit more than tokenistic, have young people to discuss this future that they want. It's just when you think about intergenerational, is how can we build a future for people who are not even here? It's not youth, it will be 3-4 generations, and what is our responsibility for these generations that are coming? What is the future that we are bringing to them? So there's these two main documents, that was the Global Digital Compact and the Declaration for Future Generations, that include all the climate and all the digital risks that are, even if they don't talk about digital security, it's part of this idea of digital security. So these documents are available online, and even that this Global Digital Compact is just a collection of principles of how to use digital technologies responsible. So it was vetted by all member states, but this is not vinculative. It's just a diplomatic tool. It's just a commitment from the member states and from the governments to regulate these technologies. And so there are some criticism also in terms of the Global Digital Compact. Nothing is free from criticism, but is already a very important step in direction of a digital secure future. And so this is, some of the outputs of this document is not only for the member states to agree. There are commissions that were formed, and one of them is the International Independent Scientific Committee on AI, and the global dialogue for the governance of AI. So all this is online, and I will finish just with a sentence from Antonio Guterres that we cannot just build a future. Let me say in English. We cannot just build a future for our grown children based on a system that was designed from our grandparents. And thank you.
Thank you, Dr. Abreu, for your brilliant presentation. So I open the floor to any questions or comments, and so that we can start a debate about equity and digital health.
Thank you.
I can start with a question,
Okay.
a curiosity.
Yes.
You mentioned briefly about the gender gap and how the implementation. Can you hear me? Okay. Okay. So you briefly mentioned the gender, how the unregulated implementation of technologies can increase the gender gap and harm, in particular, a certain lower socioeconomic level, women's health. Do you have any? Maybe I would ask you to expand a bit this topic, and if you have any examples, current evidence-based examples on how this is happening.
Mm-hmm. Yes, we have examples, and I believe there's also research. I know several researchers who are doing some research in India to understand how this limited access to technologies are harming the health of women, particularly because there's these different approaches of digital health. We can think of the digital health for the rich and digital health for the poor. And in low and middle income countries, digital health, particularly mHealth, is just a way to deliver health at a large scale with low resources, is a health implementation, low-cost health implementation. And we can think digital health for the rich in a way that, you know, these are all the algorithms and all these private companies that are offering these services to improve the accuracy of, for example, the imaging or, you know, even telehealth. So these are not accessible for people who live in rural areas. This is because they don't even have, you know, this access to technologies, but people have access to mobile phones and internet. Of course, there's still a big divide in terms of internet access. So what I'm saying is that when we think about what is the impact of digital tools on health, particularly in contexts where a big digital gender gap, we need to understand what is the intervention, what is the aim of the intervention. And most of the cases is just to reach the highest number of people with little regard of how these interventions are designed and what is the impact. Because impacting some is more than impacting none. And that shouldn't be the way, right? This will really increase all these inequities. So when we think about designing from an equity lens, we need to design, you know, for women, for the languages, for the mobile phones that they have, with platforms that they feel comfortable with using, where they know that they will free from harassment, or when they know that they can share some information online that is going to be seen by other members of the family, because in most of the cases in these low resource settings, people share phones with a family. So he's understanding the context of the gender inequalities and designing, taking that point of view in mind.
Okay. I believe in the security, privacy, and some of the laws that have been, enacted in the US and here. But how many of these things are generational? In my household, I have young people, and I have discussed with them. the concept of privacy for me and for them is completely different. They tell me everything is on the internet, everybody knows.
Mm-hmm.
And so when we design something for the next grandchildren, how much do we talk to the youth that you are saying?
Mm-hmm.
Maybe some of the things we are afraid of, they are not afraid of. So how do we can't make them change their mind at this age, but how can we, and we cannot say that we are protecting them. So how can we make sure that the concept of privacy at least aligns with the people my age and the younger people out there?
Mm-hmm. It's a very interesting question, and I don't have an answer, but if I try to elaborate, it's just young people, they are not afraid of things in general. Their brains are not developed to the point of they think about consequences long term. So maybe it's because they are young, because in 20 years, maybe they will be concerned about privacy when they are trying to apply for jobs and they realize that information online that they don't portray them in a very positive light. So I think we need to work with the evidence and with the concepts that we have at the moment that we believe are part of these fundamental freedoms and human rights. So I understand what you say, that even, the privacy is a very also global north concept. I can give you just an example that I work on this foundation called Africa Voices, and we had radio shows that would disseminate health information, and we are working with researchers in Cambridge, and we ask people to send us some SMS or through social media some information about if there's anyone in the community that they heard that they have cholera and who are people at a risk of cholera, and we are very careful to say, please don't send us personal information. We are talking about your community, because be mindful that all this information is going to be accessed by researchers in Cambridge. In the UK, when we say that is when we receive a lot of answers, because people think that they are not concerned about their privacy. They want their voices to be heard. That is a motivation higher than protect their data, right? But this has to do with meaningful informed consent. Is like people don't understanding how the data is going to be processed. And I'm saying any of us will understand how these social media platforms understand this data. They only release the information that they want, right? So if we have a full understanding, I think that we are all, even irrespective of age, concerned about data privacy and security.
Morning. Thank you very much for your very stimulating talk. Just a minor note, I don't have any social media, anything. So,
yes.
Saying that, I have a question on the relationship between your framework of security and well-being. I mean, as a provocative question, I would say, okay, what if someone trying to bring these new models start to justify the need for these IA in terms of we can improve the economic security of people in Africa because this is going to be cheap. We can improve the opportunities for nutrition because people will have more money to spend on food instead of with the doctor. We can improve the food, the health. We can improve the environment because the doctor don't need to go there because they can access through a mobile phone or a computer, and we can improve also their communitary situation. So, what if and in which circumstances you see that it is possible to improve the digital tools for health in terms of well-being, and where do you establish the boundary between the well-being improvement and the security improvement? Thank you.
Thank you. I think this is a very important question that we are all trying to answer. Like, what are the limits, right? So it's not to say everything related with AI, everything related to digital, it should be banned. No, we cannot do it. We are already there, and I think the private sector is leading it. We cannot. The only way that we can do is to find models of governance and to warn the public about the risks. So it's possible to design digital health tools in an ethical way. and in a way also for people, in low and middle income countries to use it and to benefit from them, and that will be a step further than the healthcare that they have at the moment. All of this is possible, but the point is just we need models of governance that we don't have at the moment. And I can, like for example, in the Summit of the Future, I was there. That this was in September, and I took this photo inside. I'm not just saying that I was invited. No, I'm just saying that many people were invited. But one of the things that struck me is that they were talking about technology, even that this is about the Global Digital Compact and the risks and governance. They were talking about technology in a positive way, such as they say, we know that we have all this climate challenges at the moment, but we believe that AI will help us to go into a digital future where these problems will be solved with AI. And the questions that people were asking and were related, but what about the environmental impact of AI? Because data and AI, they use energy, they use resources, they use space. I just saw a recent news, like last week, there was a small village in India where they decided to build a data farm. And with data that belongs to the community, and with all the resources of water that implies to cool down the machines, with the land uses, and they are not going to give jobs to people who live there. They will bring in people from outside, because they are people with need to be engineers and to have more tech type of jobs. So I think we need to think always like what sometimes these solutions, they bring more problems that they solve, right? And having this tech positive mind is possible, is good for us to innovate and to have new ideas if you understand the risks of these ideas and how the solutions to mitigate them. That's the whole point, is we need a balance that we don't have at the moment.
Well, thank you. I think a lot of your presentation also applies to artificial intelligence, not just other digital technology. Looking at the European framework and context, so we have many regulations at the moment. We have the recent AI Act. It looks as though also that the big corporations, that unfortunately none of them are European. We don't have Nokia anymore, so there is no big player in this domain at the moment. But it looks as though they all comply with the EU regulations. As the last time I read, and I went into that compliance sites of the European Union, they all comply. So what do you think about this European regulation and framework in light of the challenges that you mentioned?
Yes, I think that will be a model for other countries, other regions of the world. And I know that it has been applied. For example, I work in Malaysia, and in Malaysia there's like Information Act that is based on GDPR. So it's not as strict. And what I've heard is that with countries where they are just putting now these new guidelines and regulations for AI and for big data, they are based on GDPR. So I believe that there are also challenges there, because it may not apply to all contexts. And if some countries, they are very strict in terms of these regulations and other countries are not, there will be also an opportunity for the private sector to be in those countries where they are not, don't need to abide by these regulations. So we need to think about also, I think that's one of the points I say, we need more multilateral collaboration. We need international standards, international regulations that, and as a good example that what has been done at the EU.
Okay. Yeah, because, it turns out that according to the EU regulations, all these big corporations cannot do business in Europe if they don't comply.
Yeah.
So I think that will mitigate in part some of the challenges that we might face.
Yeah. And then we have China, that is an outlier, right? Like, they have their own, and China, they have their own guidelines and policies for AI. For example, AI needs to be transparent and discoverable. I'm talking about that because I work with some I work with some researchers there, and they have something that I don't believe we have at the EU, that is for each innovation, each technology that they have to have sorry, there's a name for that. Let me think. It's like they have a SOP, standard operation procedure for the algorithm and for the AI. So it's transparent, and and they understand how it can be used. And I wouldn't say it's linked to inequity, but these judgments can be done by the user, right?
Yeah, I'm a bit. I doubt the intentions of the Chinese, to be honest. But that's another discussion.
First, I would like to say that, in principle, I'm in favor of regulation, or of most of your talk. I agree with most of it, but we have to be a bit more realistic. There's no innovation if we close the rules at the beginning, and when we start saying, okay, we need interoperability. Yes, definitely we need to interoperate systems, but we need systems to exist first. And the point is, for them to exist, we need to have people that can build them. And in fact, probably now we have data for many, many years. For example, in the health domain, in many countries, that is somehow digital, probably not structured enough, but there's some data because someone started. And the point is, we can start doing the standards, or we can start doing the product. If we start doing the product, maybe it can go to the market. If we start with the standards, it will never go to the market. And the point is that we have a very nice regulation in MDR, for example, but most companies that will create innovative product in the health domain, medical devices, mostly the small companies, most of them funded by public resources, will fail. And they will spend the money due to that, not to bad regulations, but to a very poor implementation of the regulations. And where does it fail? It fails? It fails because there's no clear implementation path to create the professionals to do the compliance assessment of that technology. So what we need is a mixed approach between the top-down, which is regulation first, and the bottom-up, which is technology first, which is the US, what they do, and we talk. That's why you don't have any corporate in Europe. We don't have any corporate in Europe because we cannot do anything. We block everything to happen in Europe. There's no way any investment in Europe can strive because we are always concerned in trying to block everything that may harm, in fact, to happen. But if the US were doing the same, probably we're not even having a talk here because there was no internet at all. And this balance between private public investments is very tricky. Public can be good, but the atomic bomb was publicly funded by the defense. The internet was also publicly funded by the defense. So this is a very tricky subject, and the point is when we have very good values and we share that we need to give technology equity to all. It's true, but first we need to have the technology. It's nice to, when we have it available, then we can design apps for all people to use. I'm the first when I'm evaluating projects basically in mobile apps that if the button is not in the right condition, if it uses more bandwidth than needed, to say, you should think on design for all. But first, you are targeting a niche. And that niche is probably funded by those, whatever they are, publicly funded or very wealthy. It's a niche. AI costs money. Yes, it costs money to develop, a lot of money, billions. Costs energy. Yes. We can think that the water is needed to cool down data centers. Yes, but we don't waste water when we are cooling down data centers. It's a question of design. We should think. We should think on how to mitigate the impacts of technology and if technology is useful or not.
Mm-hmm.
But the main point is overall literacy, is the human. Of course, if Elon Musk is asking me any data from my side, I'm not sending to him
Mm-hmm.
because I cannot see on his side any values at all.
Mm-hmm.
But if he was not creating if the technology he's putting nowadays today, probably electric cars were not there.
No.
Or even space exploration was not was now in the hands of China and Russia, and probably were not secure. So it's tricky, but when technology is available, when access is guaranteed, then we can start thinking on how to make it universal.
Yeah.
While it's not available, we have to create kind of a sandbox where we can observe. And observe is not just, please give me your standard operating procedures. Yes, I can have a backdoor there, and it's not, and no one can find it. In AI, what is more important than regulating algorithms is the way we get the training data sets. Because what we are, the product of AI, in fact, is the algorithm. The outcome of a machine learning process is creating an algorithm, not the algorithm itself. So the difficulty is that. And we don't have the expertise in people to do this.
Yeah.
And we have to focus on creating better people aware of this,
Yeah.
so we can implement the policy.
Yeah, and better data, because there's also a problem with AI at the moment. You have like this data winter that if there's more and more skepticism from people, they want all these AI algorithms, they won't be as effective, right? I agree with you in most of what you said. It's not a problem of either and or. We need innovation, we need the private sector. We just need more ethical practices, right? That's where the governance can play a role. And I agree with, we need more literacy in terms of digital and AI literacy in our civil society, so we can make these decisions. Sorry, maybe we still have.
Thank you very much. I really appreciated your presentation. I just wanted to comment on Elon Musk's initiative of gathering clinical data, and starting by commenting and telling you an anecdote of a friend of mine who is Spanish and works in the US, and she actually couldn't have, she had a kidney problem, a very serious health issue, but because her health insurance didn't cover for the care that she needed there, she actually waited for 2 years to come back to Spain and receive the health care that she needed, because it was too expensive. And she's a scholar, so it's not that her wages are very low. And then she found out that there was a clinical trial for a new treatment for her kidney problem, and she was required as part of the clinical trial to do a DNA test. And when she was to sign the informed consent, she read that her data were to be disclosed by law, because it's a legal obligation with all insurance companies in the US. And so that could prevent her from getting a new insurance in the future. And when you talked about Elon Musk gathering data and scans from everybody that is willing to share this data, I was really concerned about it. I wonder if you want to comment on that, and how would you comment on that?
Thank you. That's a very good example why all these, the digital rights, they are intertwined with other rights related to health, related to jobs. Maybe You know, maybe it's not only with the insurance companies, but it's also with banks, and will impact the probabilities of getting a mortgage. Or so I think we all understand why it's so important to have this data security. And thanks for sharing that example. It's a bit shocking.
Claudia, thank you very much for the presentation. I leave this room with a lot of mixed feelings regarding what you presented, especially because I kind of agree with we need to innovate and we need to move ahead. And governments, yes, they have a role, but I want your comment, because of course there's many things that have been said that I agree or disagree, but this is not my session, so we want to hear from you. My question is, how do you see the role of governments being proactive? Because, for example, 2, 3 people now, even, I mean, with all due respect to the clinical matter, I don't see any connection with Elon Musk on this previous case, for example. And yesterday we were saying, okay, why don't we have more access? We need data from every group of population. So here's an example. Let's suppose he's not going to be a bad man, okay? Let's suppose that we don't need to judge what they are going to do with the pictures before they actually do it. And let's suppose that we have read the literature and there's a lot of bias in all the AI algorithms based on subsets of white populations from large academic medical centers. Now here's a guy, we have no evidence that he's going to do anything bad with the pictures, that asks billions of people to put up their X-rays. So it actually increases tremendously the equity of the images under analysis. Because suddenly, everyone with an X-ray or with a CAT scan can actually provide their picture. They would not be able to provide their picture otherwise, because they are in a country where their government has not created a national electronic health record that allows them to upload their pictures. Many of these countries don't even have a public-funded AI strategy. This is why they put their pictures to a private guy in the hope that perhaps that could be useful for them or their sons or daughters or whatever. To conclude, and the final comment, you mentioned on India example that digital health is often done to provide low-cost healthcare. And that you say, well, maybe it's not even good to do low-cost healthcare and to do some sort of care. I would like to challenge that, because I believe that it's better to have some sort of access, and telehealth is definitely an enabler of equity. All studies that I have read show that telehealth increases access. Now, it's not the same as face-to-face care in many cases, but at least it is some sort of care. So, how do you see the government not just regulating, but actually doing things as a way to capture people's support for more ethical and governed initiatives?
Yeah, thanks. I really like your questions, because I would like to answer them. And just also to clarify that this is not an either or. For example, for India, I think we all agree that it's better to have some healthcare than none. But for example, India has a very good system of community health care. They are called the Hashas. So these women who are trained, they are not medical doctors or even nurses. They just have some basic training on primary health care, and they go door to door in the villages. They belong to the villages to deliver health care. But if you start thinking that digital health is the solution, there will be less investment on trained community health workers. And what is happening at the moment, these women, they have to go around with mobile phones, basic mobile phones, with apps where they visit the families. They need to put the information in the apps. So the human part is being replaced by the digital part, with all the burden that this brings to this woman, with the lack of the digital literacy skills that will make this data to be very prone to error, and security of moving around with the technology, with digital tools that they can be targeted and can be stolen. So there are nuances. I agree with you in the principle, but when we start getting in the context and understand exactly what is the impact of these digital health interventions in the life of this community on people who traditionally deliver healthcare, it's not to say it's negative, but let's find a solution where, for example, these community health workers, they may have access to digital tools to help them to do their work, and they wouldn't not overburden by just putting data that goes somewhere that they don't even have access, and they don't receive the benefits of this data that they are imputing. As to with this extractivist notion, and with Elon Musk, I agree, the process is perfect if it was done in an ethical way. I think we need more data. We need, this ethical data exists. We all have electronic health records. We all have medical data that are part of the health system and in hospitals. Why governments are not leveraging this data, and needs to be a private company with with motives that we know that are profit motives to do that. It's just the process. I agree with you, but the motives and the actors are not the most ethical ones.
Quick responses. Yeah. So on the India case, what evidence do you have that it was really implemented in that way? Was it really implemented in that way, that they didn't take them into account, they didn't train them, they didn't look at their job description, they didn't see what worked, what not, they didn't pilot and then adjust the rollout? Mm-hmm. If they didn't do any of those, I agree with you. Yeah. But if they did, so that's the role of who implemented it. It's not the technology.
No,
the technology has no problem there. It was the implementers, in that case, the regional government of India, or for whatever India part we're talking about, that did a lousy implementation in 2022 when evidence exists on all the things you've said for more than 20 years. Yeah. Second topic on elements, that's not to defend him, but to say that that compares European Health Data Space is what we have for next month, January. It's the proposal for gathering the data of all Europeans to support AI. If you read the regulation, the timeline projects to 2028 when the secondary use of images will be available. And that is why people will put the images to Elon Musk, because it's next month. Whereas the EU government-led initiative is proposing to do exactly that, capture images from all around Europe in the most ethical and governmental protected way as we can all imagine, but it's proposing this for the next decade. And this is, people are making a trade-off. They're making a trade-off. Maybe they shouldn't, maybe we need to educate them, I agree with you, but I want to highlight this question, which is about speed. There's an issue about speed, which is, if we say, this road is super safe, it will get you to Porto in 3 days. This road, we don't know. Maybe there's a problem, but you get there in 3 hours. What road would all of us in the room follow? We would all follow the second one. And that is the issue. We need to suggest things that are regulated, they are ethically compliant, but they need to be at least not too slow. That is my highlight on this.
Yeah, but we all not drive the same cars. I'm not saying I'm not talking about technology. Yeah, and what I'm saying is that technology is not a solution and it's not an evil. We are talking about the implementation, and I completely agree with you. So it's about design, implementation, and impact evaluation. And in most of the cases, the problem is how the technology is designed and implemented. It's not the technology, is not a problem in itself. I just wanted to clarify this here, that the fact that we need more governance is like we need to govern the way that these technologies are designed, implemented, and used, and understood.
Just a few antidote. A few months ago, I was talking to African colleagues who are working in agriculture. And there is a big push from the north on GMO to Africa on agriculture. And I was telling them there should be some regulation. I mean, all this push. What they say to me is, these are researchers and implementers, is first people have to eat, then we'll do regulation.
Yeah.
So I think it's always the balance, you know.
Yeah.
And like you said, some of this privacy and other things are coming from the north. Understanding cultures, understanding how people think, whether it is in India or in different parts of Africa, I think is very important. There may be something that works here, but it may need to be tweaked, whether it is in China or in Africa or India. And I think in that sense, I was shocked when they told me that, but in some ways I understand. So it's a balance.
Yeah, yeah, absolutely.
Thank you, Claudia, for such an interesting and provocative and brave conference. And I would like to know whether you think that it's possible to have unbiased algorithms as long as they are based on the information that is from our grandparents, it's from present and past, and how can we solve the unbiased level of the base information for the algorithm?
Thank you for the question. I think there are people here who work on AI that can answer. I can answer in general as a principle. I think there's AI solutions to deal with biases in data. So the AI can be a problem and a solution for itself. So, yeah, but of course that we need more data, because I think these AI solutions only work if they understand what is the bias and the data that is missing. And we know that, you know, if you're talking about African countries, if you talk about health data, this health data is not as available as, you know, now because of Elon Musk, you know, maybe in the US data. So I think we still need to have the data and then to build solutions to correct biases in the data. And also in terms, one solution that I saw that, for example, the NHS in the UK is using to give access to health data is using synthetic data. That is data with the same characteristics as the health data, but it doesn't have any personal information that if it's leaked, it can put, you know, it can show the information of the patient. So there's these also innovations to respond to the challenges of the innovation itself, and that, you know, it's, I don't know if anyone here would like to elaborate more on this AI solutions for the data bias. Yeah.
Well, yeah, based in my little experience. So we have recently a very interesting and we are still ongoing project with the Hospital Santa Maria, which is the largest Portuguese hospital. And we got access to, due to very good agreements during COVID time, we had access to 3 years of all data. Can you imagine 3 years of all data of the large hospital in Portugal? So we got tens of thousands of patients. So in that way, we were able to design the training data sets and test data sets for our algorithms that would take into account, you know, coverage of many nationalities, age ranges, pathologies, and you can do that with big numbers. So the question is big numbers and good design of the training sets and data and test sets, and that's it.
Yeah.
And of course, you know, it took us almost 2 years to get the agreements with Hospital Santa Maria on a 4-year project. 2 years were agreements,
Yeah.
okay, on passing the ethical committee here at ISCTE, ethical committee at Hospital Santa Maria. 3 heads had to sign, you know, 2 years, but we managed, so it's possible. And so we are now in the path, and we advanced very much. We developed very new algorithms, a lot of theses. So.
Thank you.
Just a comment. First of all, I would like to pick up on Eric's example of the roads. If I had 10 years to build the first road, then definitely I would take the second, because that's what are we talking about. We are discussing not only 3 hours, a safe road to 3 days to reach Porto, but it would also take 10 years to build the projects, the public procurement for the safer road. That's what regulations are taking time to start building the platform. The others, the highway is taking 3 hours. So it's not definitely, if all of us would choose the second one in favor of the first, with 10 years more to reach Porto, for sure, all of us will go for the second. But okay, synthetic data is an approach when we want to use deep learning algorithms and we don't have enough data. But the point, and Rick also said that, we don't have, one thing we don't have is enough variety of data, and in most cases we don't have enough coverage of all the genders, of all the ethnic profiles in the health data. So we need to collect the data. So of course, what again Eric said, if we could be agnostic of who is collecting the data, definitely we need to find a way of speeding up collecting and analyzing data from the health records all over the world. And that's a process we need to do if we want to have the speed to provide universal care with affordable, because it needs to be affordable to be universal. So but we need to have speed. We cannot take 10, 20 years to start doing things, because when we do that, and we can also learn from standards in the tech domain. Many standards from the internet domain, for Ethernet domain, for example, were published. But when they were published, they were obsolete. No one was using them anymore. The market, the technology, have taken different approaches. So we need to find a way of creating sandboxes, regulatory sandboxes, where we can learn. Because the point is, we don't have enough people able to observe in a critical way if that data set is is covering enough the variety of people, of data, to be not biased. And that's what we need to create. In the of course, in the academics, in the scientists, we have people doing that, but we need also to have that on the regulatory part. So on the notified bodies, because we're talking about medical devices in this case, and if we look at AI Act, we are also on a high-risk approach, so we need to observe. We need to have the people able to observe and criticize what we are doing. If we don't invest in creating these people first, we are not able to implement that. We first need to learn how to do. So we need to have freedom to do, to learn with our mistakes, to create those people, the first movers, to observe and criticize the second generation. And if we don't let these first do things, even not to deploy these things in a controlled way, but deploy them, we will not have anyone able to control the following ones. That's the point. We need to learn first. And there's a researcher that in cybersecurity this week that was giving an interview that said AI is not bringing any new problems. It's just amplifying the existing ones. And it was Pedradão. The point is, the speed these problems exist, digital divide, inequality, and so on, the AI can bring is enormous. And the lack of people that were existing, because digital health issues like inequality, were existing.
And this is exacerbating them, right? No, maybe if there's other question, and I'm mindful of the time that we need to finish.
We have one question here. You raised your hand a long time ago. Sorry.
I was trying to escape from my comment there, because I was actually responding to to Enrique, and I agree, and building on the discussion that we are having about ethics and speed and the use of technology and the risks that there might be, and that we can not even imagine the risks that will follow the risks that we already know of the use of AI and technology. I do agree that technology is not the issue, though you already commented on that technology needs to be built in a way that protect the use of data, etc., etc. The technology is not the issue, but we do need regulations. I was commenting here with my colleague that actually in the US, the ethical boards are much, much picky than our ethical boards here. If I want to add a comma on a consent form, or if I want to add a comma on a questionnaire, it needs to go through the ethical board again, and it needs to be reviewed. Everything needs to be so risk plans to deal with risks of finding unexpected results. How will you handle unexpected results, etc., etc. And forms for applications, for example, to start a clinical trial are really much more detailed than forms even to apply to the EU funds for research. So Americans are really picky, for example, when it comes to research and to clinical research. Nevertheless, their own laws and regulations allow and sometimes demand that these data are disclosed and used by insurances companies and other. So I just wanted to say that in my opinion, really I agree with Enrique, we need speed and we need technology, but we cannot overlook regulations when it comes to the use of data because it can be used to actually harm people that participate in clinical trials or that disclose their clinical data to others to help them create something new for the humanity. So that was my comment.
Can I just say something quickly? And thanks for bringing that. That was one of the points that I want to make, that ethics was never a block to knowledge. So when we knew, most of you, I think, or some of you are social psychologists, we know that in the 6th milligram did experiments that involved self-deception, and they were unethical. And we could have used these arguments, but we just need knowledge. We need to understand how people are influenced by leadership. This is more important. I think it's a balance that we are saying here, is that we have, nowadays it's impossible to do any research without submitting the plan to a ethics commission. The same can be done for AI and for innovation, right? It's, of course, that will hamper a little bit in terms of the speed, but I don't think that was the reason people stopped not doing research or publishing research from 10 years ago. We just need to find better solutions. If you are so creative for innovation, we'll be creative for other solutions that allow innovation to thrive.
Any more questions or comments? Okay. So thank you, Claudia, for your really thought-provoking, and I agree with Luisa, brave keynote and presentation. I think we've reached the end of this keynote. And we can now move on to our coffee break and continue our discussion. The next session will start at 11, and we'll continue on digital health and AI topics.